So, welcome everybody. We're here to talk about criminal justice today and how it relates to all of the other systems of support that we are a part of. We've kind of changed things up. We usually say a presenter, who the presenter is, but today we have input from a number of different folks. Some of it will be informal, some of it will be more of a formal PowerPoint. So, we expect to be hearing first from Dr. William Arnold from the Tennessee Office of Reentry, Department of Labor and Workforce Development. From Victoria, and I believe it's Ricky, Tennessee Department of Correction, Director of Reentry Services. Lindsay Davis from the Rutherford County Recovery Court System, and Lachelle Ricks, also of the Recovery Court, Rutherford County Recovery Court System. And then we have the other members of the criminal justice group system of support who, if you are here, we would love to hear from you as well. So at this point, I will hand it over to Dr. William Arnold. If you'd like to begin by introducing yourself in any further way, please feel free. And thanks so much for being here.
This always works better when I unmute, I tell you. Good afternoon. As stated, my name is William Arnold, and I serve in the capacity of the director of the Tennessee Office of Reentry, housed in the Department of Labor. And I have some slides here that I want to share with you about how we have this innovative approach to criminal justice reform here in Tennessee that other states don't, and how we make it happen. Next, let me share my screen. Okay. So as I said, we are the Tennessee Office of Reentry. And we say that this is reentry in a new phase of workforce development. And before I start, I want to just first have a bit of a conversation here. And that when you think about how we've all lived our lives, we've all had to at some point ask for forgiveness. We've all at some point done something that we probably shouldn't have done. And we've all at some point, in whatever capacity, whether it was a rolling stop or whatever, we've all at some point broken a law and did not get caught. And so when you think about reentry, I always want people to consider how different would my life have been had I had a touch point with the criminal justice system, and what would that look like for me? And so as we start, I want to talk a bit about or give some definitions that you'll hear me speak about in this presentation. First is just reentry. Reentry is what I like to think of as a journey. It's a journey from incarceration, that time where you may have been in prison or in jail or even at a juvenile justice facility, back into what we call the free world or life in the community. Recidivism it is officially called the act of continuing to commit crimes even after having been punished. If we think of, in comedic terms, maybe Otis from Andy Griffith, who continued to recidivate, though he did it of his own volition. In our office, we believe that people first language is important. In other words, referring to choose words that restore, in our opinion, dignity to this population. Many times these folks are called offenders, inmates, convicts, ex-convicts, jailbirds. And so with that, we take the idea of calling them justice-involved individuals or returning citizens or even people with records as the language that we choose. Also, just understanding that this whole population of justice-involved individuals is not just people who've been incarcerated or who have been under even home confinement. These could be folks who've just been arrested or charged, and they could be justice involved, because once that happens, that touch point with the criminal justice system can create a barrier to employment, a barrier to housing, a barrier to education. All right.
Pardon me, Dr. Arnold.
Yes.
Can I ask you to please select the presentation mode?
Oh, sorry. Okay.
No problem.
Is that better?
There you go.
All right. Okay.
Thank you. And I'm having a tiny bit of trouble hearing you. I could hear you so far, but
Okay.
Wendy, am I right? Is it a little bit quiet?
Tell you what, let me turn off my camera and maybe that'll increase the bandwidth.
Thank you.
Okay, let's hope that's better. All right.
Looking good.
So All right. So the Tennessee Office of Reentry was created about 3 years ago as part of Governor Bill Lee's plan of what he called true criminal justice reform. We're the first ever Office of Reentry that's housed in a Department of Labor. You'll traditionally find offices of reentry attached to carceral organizations, much like the Tennessee Department of Correction, um, Davidson County Sheriff's Office. So traditionally, you don't find offices of reentry attached to labor. So what this does is it gives us sort of this interesting or unique perspective of seeing reentry, successful reentry, and a reduction of recidivism through a labor-focused lens. We're able to do this through partnerships with other government agencies like TDLC, one of our best partners, the Tennessee Board of Regents, the Tennessee Higher Education Commission. We work closely with a number of different organizations that are also faith-based and just people or stakeholders in the reentry space. A big part of what we do is we advocate for better second chance hiring practices. In other words, the idea of an employer taking consideration to a person who is just as involved of bringing them into the organization. It could be just giving them an interview, giving them a better look, something that says we're going to overcome this stigma. And the idea is that if a person has a pathway to a better career, he or she or them or they will then be able to reunite with their families because that job will refocus their time, effort, and energy. We have stronger families, stronger communities. Okay. Now, you say, why Tennessee Office of Reentry? Here are the numbers. 95% of the folks who are incarcerated are coming home. So that means that everyone is not serving a death sentence or they're not, they don't have life. 30,000 of the folks who are in our county jails are incarcerated. We have roughly another 20,000 that are incarcerated in our prisons, and then another 60,000 on parole. So that's about 120,000 people, if I'm not mistaken, who are under the purview of some sort of a criminal justice system. We also have to understand that 1 in 3 Tennesseans has had some touch point in the criminal justice system, and 1 in 2 of us have at least a family member that has been incarcerated. Our recidivism rate was previously 46%, which meant that almost 1 in 2 Tennesseans coming out of a TDLC facility was probably going to go back into that facility or into a TDLC facility within 3 years. Thankfully, our friends at TDLC reported that our recidivism rate has now gone down to 29.6%. So that's roughly 1 in 3 persons now instead of 1 in 2. Also keeping in mind that 1 in 3 African-American men have a felony. Memphis has the largest amount of people with a felony. And then from something that's more specific to what we do, the general unemployment rate of Tennessee is 3.5%. For justice involved individuals, it's 27%. So justice involved individuals are normally underemployed or unemployed at almost 9 times the rate of the regular population. Our goals are to advance the efforts in assisting justice involved individuals overcome barriers to employment. There are quite a few. We also work to improve the data tracking of these justice involved individuals, and then also increase the awareness of the value that justice involved individuals bring to the workforce, but just their value in the community. So first lesson, just some common aspects of the justice involved population. Understanding that this population has high instances of mental illness due to the trauma that incarceration can bring on. Substance use and behavior disorders are very prevalent in this population. People of color are also disproportionately affected. People with disabilities. There are also low levels of literacy. I think the average education level is about 6th grade for folks who are justice involved. There are a number of persons who are also English language learners. There's homelessness. Most folks who are also justice involved come from impoverished backgrounds. So a number of challenges for this population. So just some common barriers that they have. First is housing. It's kind of hard. Our ultimate goal is employment. And when you think about the fact that it's kind of hard to go to work when you don't have housing, because you can get there, and then when you get off, not having anywhere to go can keep you from maintaining that job. Identification and documents are also a big concern normally with justice involved individuals. Folks coming out of incarceration normally don't have a driver's license, state ID, birth certificate, or a social security card. When a person is on probation or parole, sometimes those things can be a barrier, particularly if you're trying to get to work. I mean, having to go to different meetings, not having adequate transportation, not having support from your family, not having support from society. These are all things that can create barriers. Also, things like just a general lack of food, clothing, transportation, access to medicine. Many folks who are justice involved often have high instances of chronic illnesses and no access to medication. And then finally, healthcare. I'm sorry, childcare. Just having children and not having anyone to take care of those children when you're looking for a job or having to go to a probation or parole meeting. Now, I want to stop here and just sort of plug our American Job Centers, because for us, this is where the work happens. Our American Job Centers are across the state of Tennessee. We have 21 comprehensive American Job Centers, and this would be our front door for serving justice involved individuals. Through federal funds provided by the WIOA Act of 2014, the Workforce Innovative and Opportunity Act, we're able to serve justice involved individuals with things like educational classes, skills trainings, credential courses, uniform costs, books and supplies, housing assistance. So in other words, we work to help overcome some of those barriers as we help those folks get back into the workforce. And so with that, we have sort of our best practice, or some best practices of how you serve this population. And first is just being holistic. I mean, looking at the whole person, understanding that there are a number of different needs, and how can we find intersectionality to address all of those needs. Being person-centered, knowing that each person's reentry journey is different. It's not going to all be the same, because people are going to come out of incarceration or have touch points with the criminal justice system who may be highly educated, who may have high levels of family support, who may have strong skills, things that can actually help them make it through the world. So keeping in mind that each person has a very different journey through reentry. Being strength-based. Many times you're talking about a population that has been beaten down by society, and being able to find and identify strengths that you can build on with this population when servicing them is very important. Being trauma informed. You can't imagine what it's like to be in a cage, to be chained or locked up to something. So many times these folks have high levels of trauma, and a lot of times that trauma can come before they were even incarcerated. Just life beating them down, and that life beat down resulting in incarceration. We've also found that being collaborative is very important. Understanding what state agencies have resources, or getting them to reimagine or rethink how they service individuals, particularly this population. We've had a number of conversations with colleagues from the Department of Mental Health and Substance Abuse, Department of Human Services, Children's Services, who have all in some way been able to take their services and utilize them to service this population. And then finally, being culturally responsive, just knowing that a number of marginalized groups, as I stated earlier, are a part of this population. Knowing how to adapt your behavior, your understanding of people is important in serving this population. And then connections to make. Always corrections related organizations like jails. We have 95 county jails across the state. TDOC has a network of organizations. In addition to its prisons, they have day reporting centers, community resource centers. Victoria, I hope I'm not stealing some of your thunder here. There are also probation offices, not just attached to TDOC, but also to our local county governments. And there's also the Tennessee Reentry Collaborative, which is another great organization that TDOC facilitates. But then there are non-corrections related organizations that really work in this space, a number of different nonprofits, particularly in the Middle Tennessee area. They're faith-based organizations that service justice involved individuals. as I stated, government agencies, our Title I staff, which is housed within our American Job Centers, that helps with quite a bit of training, other reentry focused organizations, and our one-stop operators, which is another staff member in our American Job Center. Some things we've done since opening our doors is we've had a couple of public facing campaigns. First is our It's Okay campaign. When we first opened the Office of Reentry, we found that there was no way for folks to self-identify or to know that they were even justice involved, because rarely are people called that. So we started this campaign in an effort to just normalize reentry. You've been charged, you've been arrested, you've been convicted. It's okay. It's okay. We want to help you get back to work. We want to help reduce that stigma and humanize this work. And then we have our Second Chances Work campaign, which is an employer-facing campaign where we actually seek to engage and educate employers on the business purpose, the moral purpose of actually investing in justice-involved individuals as employees. And through this QRC code, you can actually access our employer toolkit and a checklist that employers can use to sort of do their own internal understanding of what are my policies, my practices, and my procedures that may be seen as limiting justice involved individuals from working for my organization and thriving in the workplace. Something that we use to also increase awareness is we have a reentry simulation. This is a 2.5 hour roughly experiential event where our staff will come out and we'll facilitate it for organizations. We can handle up to about 60 people, and it'll give you an idea of what it feels like to go through a few weeks as a person reentering society, not having access to resources or having special circumstances that keep you from living and working in certain places, or just some of the things you'll experience in this reentry simulation. We also have a grant that we fund through our office. We call it the Community Reentry Reinvestment Grant, or CRRG. It's a 1-year competitive grant where for-profit organizations, nonprofit organizations, and other governmental entities can use labor market information to determine what are some of the in-demand industries that we can train a pipeline of justice-involved individuals to prepare for entering the workforce. We ask that in this proposal, you have certain partners. As I said, first would be a pipeline partner. Next would be wraparound service providers, folks who can give them perhaps the mental, the spiritual, the social support that they'll need as they're gaining these work skills. And then finally, an employer partner. And that would be the person, or not person, but that entity that says that upon this population gaining the skill set and matriculating through this program, we will give them that fair chance look of an interview and hopefully a job. I don't know if we're taking questions now, but have this. And also, if anyone wants to have a survey, I always want to try and get better. Continuous improvement is a big deal to us. So thank you.
Thank you. Thank you for sharing that. I have I don't know if there's a question, but would you share a little bit about the podcast, Talking Second Chances?
Oh, I'm so sorry. Yes, we also have a podcast, Talking Second Chances. Trevor White, who is our data and research analyst, hosts this podcast that each month we have a guest, normally someone who's operating in the reentry space in a different capacity. We've had our commissioner, we've had folks from the governor's office, we've had some of our staff. Half of our staff is formerly incarcerated. But to talk a bit about what does it mean to have a second chance? What does it mean to have a fair chance? And what are some ways that we can continue to do that?
And I'd highly recommend it. I've listened to a few of them. I haven't listened to all of them.
Super.
And you made a point that I first heard there, and you made it again now, that I just want to reinforce to everybody, because we are frontline, for the most part, providers, or the people that have a pipeline to frontline providers in all of the other areas, that 95% of people will be returning back to the community. To me, it was just striking, and it makes what we're doing here so much more meaningful. we have to understand um, who these folks are and how we can best help.
Yeah, and we have our friends at Dismas House in Nashville, a local transitional home, has this saying that I like, and that's who do we want them to be when they come home? Because they're going to be our colleagues, our coworkers, our church members, our neighbors. And what type of investment are we going to make in them now? So when they come home, they can be that person that we want them to be.
Right, right.
Thank you.
Thank you. I want to open it up to Victoria. Was there anything
Yeah,
that
so I'm gonna piggyback off of Dr. Arnold's presentation, even though it's a little hard to follow him sometimes. But I'm Victoria Ricky, Department of Corrections Reentry Director, and I work alongside Dr. Arnold and his team. So my focus is more inside the facilities. So I'm working with the individuals before they're hitting that door and transitioning out into the community. So I just wanted to share with you guys, there's 5 evidence-based strategies for reentry that the National Institute for Justice has published. So the first evidence-based strategy is going to be programs and services. So what that means is that we provide a risk needs assessment, and we are doing that currently in Tennessee. Off of that risk needs assessment, we are determining what risk factor they are, and then what programs do they need. NIJ also recommends using gender response programming, especially just within the women's population. You do see more of a trauma-based, more of a domestic violence situation, and we even focus on trafficking. The second strategy is going to be support services, holistic in nature. So like Dr. William Arnold was saying, we want to attend to everyone's need, the person's needs overall. So you can't take away from one need to make another greater, or have a greater success rate. So if they need housing and a job, we need to focus on them together, not as separate entities. The third is going to be family support and services. So having that mentor before you leave the facility, having a church that you can go to, having family. And we do that by incorporating our visitation. And I know some of the county jails are really good at using the tablets to send messages back and forth to your family or have video calls. And then we have started working with our DHS Child Support Reentry Office on family reunification. And we actually have a fatherhood class at our attorney center that is being taught by our partners, TAGI. Nextly is going to be programs that include cognitive behavioral therapy. So we need any programs that recognize harmful behavior. Right now we have CBIP, which is cognitive behavioral therapy, and then we go into PTSD. We do specific veterans ones, and then we also do ones for juvenile justice as well. And then thirdly, community supervision works best when it combines both surveillance and support functions. So we need probation and parole officers coaching based on assets. So using those services like the American Job Centers, coaching them towards employment, towards getting involved in the community in a positive manner. So all of these things have found to help an individual be successful in their reentry. But piggybacking off of what Dr. William Arnold said, the barriers that we do face in Tennessee is definitely housing, especially since Nashville has gotten so expensive. It is very hard to place an individual. They can't just rent from a normal apartment complex. A lot of times they have to go through private lenders or Facebook Marketplace, and then sometimes they can be scammed. On TDOC side, we do have a list of transition center housing that supports our substance abuse recovery. So that is definitely a big barrier. Our ID documentation, we are lucky enough to get a grant or a pot of money from the governor's office, and we do pay for everyone's ID and birth certificate if they're eligible before release. So they're releasing I call the holy trinity of documents. So they're getting a social security card, birth certificate, and ID upon release. Employment, we do have employment specialists, and then we are partnering with Dr. William Arnold's team to get through those. But the biggest thing in my experience is that social support again. So if there's ever anyone that would like to volunteer or be a mentor, just get with myself or Dr. Arnold's team, and we can link you to those services. Thank you.
Thank you, Victoria. That was really helpful. I want to, before we open up to any questions, I want to get to Lindsay and Lachelle, because I think Lindsay will have to drop off at some point. Lindsay, are you there?
Yes, we are here. Me and Lachelle are here together. 1 second and we will share our screen with our slides.
We're trying to figure out how to share the screen, but Lindsay's gonna maybe just introduce what we do.
Also, this is Jennifer. I'm going to go ahead and pull it up. I've got it handy, so y'all don't worry about that.
Thank you, Jennifer.
You're welcome.
It's that green button down the bottom. Jen's got it. All right.
Okay, perfect. So again, I know she already said, my name is Lindsay Davis. I am the Reentry Program Coordinator underneath the Rutherford County Recovery Courts. And then
I'm Lachelle Ricks. I am the director of the Rutherford County Recovery Courts here in Rutherford County.
So we are going to tell you all a little bit about the recovery courts within Tennessee. Mainly, we'll be talking about our jurisdiction, which is the 16th Judicial District, which encompasses Rutherford and Cannon counties.
Can we move the slides or do you?
Jen, it looks like the slide, this is Paula, it looks like the slide may be stuck on the slide deck versus the slideshow view. The beautiful opening slide.
Sorry, just 1 sec. I'm trying to get that.
She's working on it.
Thank y'all. Just a minute. I'm sorry. I've got 3 views of it, and it looked like I had the perfect one up.
Well, I can start giving you some information while we're figuring all this out.
Yeah, sorry about that. I'm trying.
So recovery courts are also called treatment courts or problem-solving courts. We're basically a form of judicial supervision. People tend to look at us like probation, except for we provide treatment and other therapeutic services for people dealing with significant mental health and or substance abuse issues. In Tennessee, currently there are 82 recovery courts who are judicially supervised. And we're, the main goal is to reduce correctional costs, protect community safety, improve public welfare, and reduce recidivism within our state. In recovery courts, nonviolent individuals with substance use disorders participate in the treatment programs while they are still under close legal supervision. We have treatment teams, which consist of the judge who's over the court, a DA, public defender, a representative from the sheriff's department. Some recovery courts will have probation as well, ours do not. And then we have our in-house treatment staff of case managers and clinicians.
I'm sorry, I'm doing my very best and I'm just not able to grab this to move on. Are you guys seeing I stopped sharing for just a minute and I'm gonna try and get that back up. You are seeing the slide?
How about now? Can
But
you
not-
see our side?
Yes.
Perfect.
Sorry about that.
It's okay.
Sorry, I really was trying to get it.
It is okay. I appreciate it. Sorry, we're
Thank
having
you.
some technical difficulties over here. So this photo that we've grabbed right here comes from the Tennessee Department of Mental Health and Substance Abuse Services. So this goes over a little bit of the current court locations across the state of Tennessee. So like Lachelle mentioned, there are 82 across the state. There are 50 adult recovery courts. There are 10 veterans treatment courts. There are 9 mental health courts. There are 7 juvenile courts. When this was produced, there were 4 DUI courts, 1 family treatment court, and 1 human trafficking court. They reported over 1,600 new admissions with the funded courts in fiscal year 2019. So I'm sure that has grown since then as well.
So for Rutherford County specifically, we have an umbrella of services. All of our courts are under one roof. So we have a DUI treatment court, mental health court, our recovery or drug court, a veterans court, and then our reentry services, which are specifically, that's a hard word, in the jails. And we have 2 facilities that they are currently giving service to right now. So we'll go into a little bit about each court. With our DUI court, you have to have a second offense or a greater of a DUI or multiple first DUIs. A DUI can be due to alcohol or other substances. We're finding now that DUIs are more than 50% are other substances than alcohol. So, any type of drug substances can be considered a DUI. Ours is a 12-month program and we have 4 phases. And we added an evening program about 2 years ago to make it a little bit easier for those who can work normal business hours for them to come back and do our programming. And all of our courts are presided over by a specific judge. Our veterans treatment court, you have to be active duty or a veteran in the military, and that will be verified with your DD 214. We currently have 2 tracks of this court. There's a high risk, high need, which most of the recovery courts that you will come across are, and that is an 18-month 5-phase program. We also in our veterans court have a moderate risk, moderate need program for those who may have lesser charges or who don't have as much of a high risk of recidivism as others do, but still need some sort of treatment, supervision, oversight. And that is a 12-month 4-phase program. We also partner with the VA to ensure continuum of care. So they come into our program once a week and they provide peer support services, therapeutic services, and they can be the liaison between us and the VA to get our folks into the programs that they need outside of recovery court. Our recovery or drug court, which is, historically the foundational court that most people start with. You have to have a primary substance abuse disorder, but we do accept co-occurring disorders as well. It is a completely high risk, high need court. Most of our people who come into this program are actively using or they're coming from jail, having, recently been actively using, and oftentimes they will need some sort of inpatient or high intensity treatment once they enter or prior to coming into this program. It is an 18-month program minimum, and I say minimum for drug court because usually it lasts a little longer for them, just because there are a lot of different needs and risks that we have to address while they're with us. And the court that we have here is our mental health court. And they need to have a primarily, the primary cause of them entering is a severe and persistent mental illness. They may have a co-occurring disorder. Some of them do, some of them don't. It's fine with this court. We unfortunately don't always take those with TBIs, autism spectrum, or intellectual disabilities, just because they are kind of outside of the scope of services that we can provide here. But as often as we can, we do try to refer them to other services and agencies to give them the assistance that they need. This is also a high risk, high need court. If anybody has worked with mental health, you know that there's always a high need with them, and they tend to have a higher risk of recidivism, especially when they go off of their medications and they don't have the support systems available to them. And it is a minimum 18-month program as well.
This is probably something we probably don't need to cover with the group that we have here today, but we did want to throw it in here. What is a severe and persistent mental illness? So we do have schizophrenia, bipolar disorder, major depressive, PTSD. I'm sure that we're all familiar with the different levels and the severe persistent mental illnesses that we may see, especially in the criminal justice system. So how do our treatment courts act in the community? So again, this is the stats for Rutherford County, but we do have some recidivism rates that we have included here. The mental health court reports a recidivism rate of 11%. The drug court, or the excuse me, the recovery court has a recidivism rate of 6%. The veterans treatment court reports a recidivism rate of 2%. And then the DUI court reports a recidivism rate of also 2%. So the most recent statistic that we have from the state of Tennessee reported a recidivism rate of 47%. So those rates compared to the state average are significantly lower.
So who do we serve? You have to be at least 18 years old, nonviolent offender for our recovery or drug court. Some of the veterans court, mental health court, they can take those violent offenders depending on the charge, but with our recovery court, it is Tennessee state law that we do not allow violent offenders into that program. And you also must live within our county, Rutherford or Canton. Those who are ineligible are those with those violent charges, murder, homicide, firearm, arson, sex offenses. If you're living outside of the county and do not plan on moving into the county at any time, you also would be ineligible. If you have an active warrant, so in another jurisdiction, you would need to satisfy that before you could come into our program. And also you can't work as a criminal informant while you're here with us.
So just some general information of some of the requirements that participants are required to do while they're in one of the programs here. They will participate in frequent and random drug screening. They will also frequently report to court based on which court and which phase they are in. They will be engaging in treatment, so counseling, groups, individuals. They will take all their medications as they are prescribed, and oftentimes they're counted with their case manager to ensure they are taking the correct dosage. Home visits will be conducted monthly by their case managers. They will have travel restrictions as well, so they do have to ask for permission if they would like to leave the county. And then incentives and sanctions are given based on the programming and what the violation may be, and then for the sanction, and then the incentive will be based on, the progress that they make in the program and during their phases. And all of these cases are furloughed in by the courts. So either our general sessions court or our circuit criminal court will furlough the individuals into the program.
So as we've kind of talked about, the services that we provide is case management. We have case managers assigned to each court. Alcohol and drug counselors, all of our counselors are LADACs, and they provide substance use counseling. We have therapists on staff. We have 4 of those. One of the things that we provide that many of the other courts do not is occupational therapy, which they work with mostly our mental health court right now, just providing assistance with ADLs, medication management, any type of skill-based therapy treatment. They help with those. And then we offer groups on evidence-based practices. So criminal thinking, anger management, life skills, seeking safety, all those. And we do refer to community-based services. We partner with some local mental health agencies, as well as some treatment programs, if we need to refer to those services.
So this again is specific to Rutherford and Canyon County. So this is how individuals who are interested, who can apply to the program. So they can do a self-referral. They have an application on what we call the kiosk inside the jail facilities. So they could submit that application on their own. They could walk into the office if they're out on bond, or they could get an application from our online website. They could also be court referred, whether that's by their attorney, the district attorney, a judge, jail staff, or the arresting officer can do a referral on behalf of the potential client. And referrals can also come from the community, a potential mental health case worker, a social worker, DCS, any of those types of agencies can do a community referral for the individual. And another subsection of the recovery courts is our reentry program. So with the reentry program, we go into the jail facilities within Rutherford County, and we provide a lot of the same things that they provide in the building for the individuals who are on furlough, but all of our clients are still incarcerated. So some of the things we provide are groups, classes, case management, individual counseling, group counseling, and there's a list of the programs that we offer. They're all evidence-based cognitive behavioral courses, anger management, relapse prevention, seeking safety, which is coping skills, MRT, which is moral recognition therapy, and untangling relationships, which is a codependency course. The incarcerated individuals, they must voluntarily enroll in the programming while they're incarcerated. So it's not forced upon anyone. So we get individuals who actually want to work towards a goal while they're incarcerated. And that is all that we have.
That was fabulous. Thank you. I learned today that there were more than just substance use recovery courts. It just sounds like an incredible system. What an important system to have in place. Is this something, I know Dr. Arnold talked about, there are things unique about Tennessee that they're not doing in other parts of the state, other parts of the country. Is this one of them? Is recovery courts something that's across the country?
Yes, they are. There's recovery courts in every state across the country. We're actually going to a national conference in May with all the recovery courts in the United States.
That's great. And Lindsay, you talked about in our planning sessions, cognitive classes. Is that kind of the umbrella term that you give to the classes that you mentioned, or is that something different?
No, that is definitely all the classes that I mentioned. They're all cognitive behavioral, CBT, cognitive behavioral therapy courses. And so we do offer those in the facilities and in the recovery courts as well.
Great, excellent. I'm going to save, so I want you all to think about what questions you have. Again, because we said we kind of want to protect your privacy, will come off of recording, not just yet. And unless there was anybody from this team that the presenters today that wanted to share anything else before I share again. Anybody? Victoria, did you have anything else to add? Dr. Arnold?
I don't at this time.
All right.
Nothing here.
Okay. All right. I'm going to share my screen again real quick. And I'm going to drop down here a bit. Share all of that. Okay. I'm going to share from here. So I just wanted to take a minute. Oh, it dropped anyway. It's there. I wanted to take a minute and just share about the intersectionality between brain injury, because that's our area. That's what we're really excited about, what we're passionate about, our system of support, and how that intersects with the justice system. And there's a huge intersection. So after brain injury, within 5 years after that injury, about 1/3 report some involvement with the criminal justice system. the CDC recognizes it as such a big deal, TBI, in prisons and jails, as to call it an important public health problem. In the adult justice system, it's like 50 to 87% have had a TBI. They have a prior history of traumatic brain injury. To me, when I learned that, I was like, that was huge. That we've got to be, I think, considering traumatic brain injury and a history of traumatic brain injury in all of these folks, compared with 8.5% in the general population. So that it's much, much bigger. They say with women, people will say that is close to 100%, and that involves a lot of domestic violence that has caused the brain injury. And people with a TBI are 12 times less likely to receive a discretionary release, and that's probably because they're getting into more fights. They can't control their anger and their impulses as much, so they're getting themselves into trouble. So people who have had a brain injury, they're very likely to have cognitive deficits. That's why I was asking Lindsay, like, what did you mean by cognitive for us? And you were talking about CBT. That makes a whole lot of sense. For us, it means thinking. It is, what is your thinking like? And after a brain injury, we tend to see difficulty with things like attention and memory and speed of processing. It can often look like it's defiance, so it leads to disciplinary action. So if you're asking me for an answer and I'm not giving you an answer fast enough, in part because I'm thinking about what you just said and trying to understand it, and then I'm trying to think of how I want to respond to you, it might look like I'm just being defiant. I'm not answering you. Or if I can't remember a rule, this is so when I'm within that part of the system, like the prisons, but when I'm outside, I might, let's say with the initial law enforcement, I may not be following your commands to me, what you need me to do to protect all of our safety. I may not be following that fast enough. And again, I may look defiant. I may become overwhelmed in that environment where, let's say, again, we're just with law enforcement out in the community. This is my first encounter with the justice system, and it's loud and I'm scared and there's a lot happening and you're yelling at me what you need me to do. That can actually kind of increase my lack of behavioral control, and my overwhelm is going to be on overdrive. So that can lead to lots of difficulty. So we teach crisis intervention teams with law enforcement about how do you kind of approach people out in the community. We see irritability, anger, impulsivity, uninhibited behavior that can lead to altercations out in the community, in treatment programs, in prisons. And then the cognitive changes can lead to problems in transitioning to the community, as you might imagine. And then what best practice is that accommodations should be used to compensate for the cognitive deficit, to help people within the judicial system, including in court. So making sure that people have what they need in order to understand, in order to reply. Do they have things that are in writing so that they can see it? How are we handling those kinds of things? They need accommodations when they're returning to work, returning to the community and to these treatment programs. And so that could be, just to give you an example of accommodations, that could be just speaking more slowly when you're working with someone, giving them more time to respond, taking notes for them, giving them something to take notes with. It can be a lot of different things, but they're simple things like that. And we're trying to encourage people to be using them within their systems, because it is kind of, once you understand this idea of accommodations and what they all are and what problems you might see and how do you identify it and all of that, then applying accommodations can be simple. But if you're asking the person to be applying them, that as opposed to like me talking more slowly, something like that, then it needs a lot of repetition and reinforcement of those accommodations. And I just wanted to share this this criminal and juvenile justice best practice guide, and it goes through all of the different all of the protocol. So beginning with identifying that somebody, screening that someone has a prior history of traumatic brain injury, educating them on that injury, doing some quick screening for cognitive deficits if you found a prior history. And I shared when we spoke brain injury, when our system of support spoke in July, that it costs $150 to train someone to do the, you don't have to be trained to do the screening for a prior history of TBI, but there's a very simple, it's like 3 or 4 modules and $150 to become someone who can screen for cognitive deficits. So a great program. You can go back into our information and find out that, look in our PowerPoint, or we are happy to guide you toward that. So this goes through that whole protocol of that, and then building in accommodations into the systems, making sure that our staff is educated to be providing those things. And then there is another guide for resources to address TBI within the juvenile justice system. And then I don't think I put it here. No, I did not. There is also I think I thought of it afterwards, that really it starts with law enforcement, again, out in the community. And there is a great, we put it in the resource pages. It's from North Carolina. It's like an infographic / fact sheet that talks about crisis management and de-escalation. Now, it's geared toward law enforcement out in the community, but it's really great for anybody who deals with crisis management and trying to de-escalate situations. It just gives very helpful, simple strategies to use. And so with that, it's going to look like we're done, but we're not. We're going to say goodbye to the people who are listening to this after the live meeting, and they can fill out this survey. This will ask you all to do this at the end of this meeting, and anyone can attend the next meeting on homelessness on May 2nd. We would be happy to have you there with us. So with that, we are going to stop recording.